Board now. Perfect. Before we get started, we're joined today by Vitalist CEO, President and CEO Suzanne Fieser. So I wanted to turn it over to Suzanne just for some opening comments.
Thank you, Marcus. It's so wonderful to see so many partners on the line on our call. So I just want to thank you all so much. This is an incredible opportunity. It's an amazing, it is the result of an enormous amount of work from Access and talking to community partners and developing this. We are one of just a handful of states that have this kind of program. And so, and of course, we're going to be best at it. We get to learn from those that have come before us. But I just, on behalf of the community that works on affordable housing, I really want to thank the Access staff for all of your hard work and commitment to making this project what I know will be a model for the rest of the country. So, but it will be best only because all of you have helped make it that way. And this is another extraordinary time in that Access is asking for our input, our wisdom, and so you can help make this the program it needs to be to serve our community and the entire state. So thank you again for your commitment on time. Thanks to Access for the talent, and this has been a lot going on, a lot of moving parts, even with a new administration. But I believe with the talent that is represented on this Zoom and other people that will lend their support and wisdom, that we will have a wonderful rollout.
Thank you, Suzanne. And now we're going to turn it over to the team at Access. So Dana Flannery and Alex Demian, I will be helping to share your slides, which I'll pull up right now. And I will go ahead and turn it over to you. So ladies and gentlemen, some of our close colleagues at Access, Dana Flannery and Alex Demian, who have helped to actually put together the Housing and Health Opportunities Waiver that was approved by CMS a couple of months ago. And they're going to take some time to kind of give a brief overview of what this H2O program actually is, and to help answer some of the initial questions that any of us might have. So Dana and Alex, the floor is yours for the next 30 minutes.
Thanks so much, Marcus. I'll go ahead and introduce myself, but you'll be hearing from Alex today. So I'm Dana Flannery. I'm the Senior Policy Advisor here at Access and also the Assistant Director for the Division of Community Advocacy and Intergovernmental Relations. And one of our many amazing tasks is the Waiver and State Plan. And so you'll hear from Alex today as to the contents of the waiver as it relates to housing. So Alex, to you.
Thanks, Dana. I am Alex Demian. I'm a Deputy Assistant Director for our DCARE division. Before I get started, I actually wanted to have a couple of my colleagues introduce themselves for the purposes of this meeting, and because as we go to implement this, you'll be hearing from each and every one of them at some point, I'm sure. So I want to make sure everybody's able to have a face to the name. So I will go maybe Liz, Shreya, and then Susan Podchadley, and then I'll go ahead and get started with the content.
Thank you so much. Yes, Liz DaCosta here. I'm the Housing Program Administrator with Access. So as Alex said, taking all your feedback back and then helping to work to implement a implementation plan that we'll send to CMS for approval. So thank you so much for joining us.
Thank you, Liz. Good afternoon, everybody. My name is Shreya Arakere, and thank you so much for the opportunity to be with you all today. And I manage something called the 1115 waiver here at Access, and which is one of the two contractual agreements we maintain with the federal government that gives states such as Arizona a flexibility to design demonstration projects, which is typically not allowed by the Medicaid law. I'm sure Alex will get into a lot more detail during his presentation around waivers, and I'm excited to hear from you all today. Thank you so much. I'll turn it over to Susan.
Thanks, Shreya. Good afternoon, everyone. I'm Susan Podchadley. I work at Access as the Program Director for the Whole Person Care Initiative, and housing is a big part of that initiative. I'm so grateful you're all here today. With that, I'll pass it back to Alex.
Awesome. Thanks so much, you all. We have a lot of other very involved and knowledgeable colleagues from Access on the line as well. But in the interest of time, I'll go ahead and launch into our content here. And Marcus, it's a lot of info to get through in 30 minutes, so just, you know, poke me or something if I'm going over. So if we go ahead and move to the next slide, before getting into the H2O specific content, wanted to start with some level setting around a topic that Shreya mentioned, which is our 1115 waiver, and just sort of a level set for those on the line around Medicaid in general, and some of the parameters that we as Access operate within as Arizona's Medicaid program. As many of you on the line are likely aware, Medicaid's a state-federal partnership. In general terms, what that looks like on a financial side of things is for in Arizona, every dollar the state contributes to Medicaid, the federal government kicks in about $3. In order for us to continue claiming and what we call drawing down those federal funds, Access has to operate within our contractual agreements with the federal government. We have two main agreements, or two authorities as we call them, for intents and purposes, that we use in Medicaid in Arizona. The first is our state plan document, which describes the aspects of our program that are allowable within the framework of the Social Security Act and Medicaid regulations. A lot of our covered services, covered populations, reimbursement methodologies are detailed in our state plan. The other authority, which is where we'll be spending the majority of our time today, is called the 1115 waiver. Section 1115 of the Social Security Act allows flexibility to design demonstration projects not otherwise allowable, as Shreya mentioned, under Medicaid law. Those initiatives need to promote the objectives of the Medicaid program as it's defined in federal regulation and federal law. The demonstration projects are typically approved for a 5-year period and can be renewed again after those 5 years. For those familiar with our system, it's the 1115 waiver that allows us to do things like managed care, our home and community-based services that we provide to our membership, our long-term care members, our targeted investments program, if there's anyone on the line familiar with that program, as well as H2O, which I'll get into in a lot of detail here in a moment. Whether we leverage the state plan or the 1115 waiver, it's really important to note that any change we make to our program must first be approved by our federal partners at CMS or the Centers for Medicare and Medicaid Services before we have the authority to implement that change. So it really is a tight partnership that we have with our federal oversight partners, and we worked very closely with them throughout the development of this waiver and the initiative. If we go ahead and move to the next slide. Oh, yeah, perfect. So with H2O, there's a number of steps we'll have to take in order to implement now that we have approval under our 1115 waiver. This program is not a faucet that we can just turn on and roll reimbursement to providers and organizations tomorrow. As you can see on the slide, we'll take that first year of the slide breaks sort of down the different phases of implementation that we'll have to go through. We'll need to take about a year from approval. And for a little bit of background, we did receive approval of the initiatives that I'll detail in a moment on 10/14, excuse me, of 2022. So about a year from that October 14th date is when we anticipate going live with the programming that we'll discuss here after we've made all of the implementation decisions and things like that in partnership with you all. But really, we want to be as thoughtful as we possibly can be throughout that first year to engage with the community, engage with stakeholders such as yourselves and others to develop things like the rates that we'll be applying to this program, claiming protocols, provider types if necessary, any policy or contract language that we'll need, and really work through that first year to codify all of those. Additionally, we're going to leverage the first year of approval to build and provide any technical assistance that might be needed as we ramp up for implementation. In addition, we'll use it to allocate resources throughout that first year necessary to prepare any involved organizations in the system at large for go live. This waiver approval is really the first domino to fall in implementing a successful program. So I really do want to frame the approval as just that, the first domino. We have a couple big deliverables, actually a lot of them, but in relation to H2O, we have a really big waiver deliverable due to CMS in the coming months called our implementation plan that'll describe how we plan to implement H2O. That document will get into the nitty-gritty of what the program will look like, what it'll feel like for members and providers alike and any other involved organization. The deliverable is really, I think, where we're going to use and where we can use this group's help to shape what the program is going to look and feel like and what it should look and feel like. That implementation plan combined with the first year of implementation planning is critical to us as we're looking at it to ensure that the funding's directed appropriately and to make for a successful program for everyone involved. Really looking forward to your all's feedback, but did just want to provide that level set as far as what the time frame will look like, and request that you all, as I'm going through all this content, please keep an eye out for questions related to like processes or resources that you might have, general questions on how certain things will work, preferences on how certain things should work, etc. If we go ahead and move to the next slide. So I'll start with services. So with all of that as pretext, I'll get into what the approval actually gives us authority to move forward with. So for those that might be familiar with our H2O proposal that we submitted like 2 years ago and a year and a half ago now, it's been a long time. We were negotiating with CMS that whole time, and we did receive finally approval for the vast majority of the housing related items that we submitted. CMS approved the housing items in sort of two parts, those being infrastructure and services. I'll get into infrastructure in a while, but I wanted to start with services and sort of what eligibility is going to look like as we're proposing it currently. We want feedback, and I guess it's probably a good time to mention that all of this is malleable. These are proposals at this point, so we really are looking for honest and candid feedback on what will make this more successful once we do hit that go button. If you look at the list on the screen, I'll go through each of these items individually in subsequent slides, but the marquee item we received approval for that's probably the most exciting for the community and one of the most exciting for us for sure is the ability to reimburse for up to 6 months of temporary housing through Title 19 Medicaid dollars. We also received approval for transition housing navigation and supports, medically necessary home accessibility modifications and remediation services, case management services, and outreach. I'm sure there's questions on those, so hopefully they will be answered in the upcoming slides. If we go ahead and move to the next slide. Again, this is probably the one everybody's most excited about, and it is pretty groundbreaking. We were one of the first batch of states that received approval to use Title 19 dollars for this purpose, but for the target population, we are able to pay now for up to, once we go live with this program, we're able to go pay for 6 months, up to 6 months of rent or temporary housing when members are transitioning out of an institutional care or congregate setting, correctional facility, and hospitals, for individuals who are homeless or at risk of homelessness, as well as individuals transitioning out of the child welfare system, including foster care. Currently, we're anticipating that this might look like one of two things. One, H2O being able to pay for 6 months of something that would look a lot like rent for members who are identified as eligible for H2O services, and then payment for enhanced shelter services for up to 6 months per member. This could entail things like settings that have a low staff to member ratio, would allow reimbursement for operations and things like that, things like lease, mortgage, utilities, housekeeping, potentially maintenance, and bedding, etc. So really trying to take a multi-pronged approach on what that short-term 6-month housing could look like to allow for optimal flexibility for member situation and resources that are available in each area of the state as well. When it comes to housing stock and capacity, we know that could be an issue. So we want to be considerate of that, but if we go ahead and move to the next slide. So housing transition, navigation, and support. So in addition to the 6 months of housing for the targeted population, we also received approval to reimburse for housing transition, navigation, and supports. These the services can include activities such as paying for utility costs, activation expenses, and back payments to ensure that utilities are active upon move-in, pre-tenancy and tenancy sustaining services, housing transition and navigation services, and one-time transition and moving costs. We can go into a bit more detail on a lot of these further if clarification is needed, but did want to call out the pre-tenancy and tenancy sustaining services, as this is where we assume a lot of the sort of hands-on work will occur with the member related to the wraparound services and supports. So pre-tenancy services for the target population can include activities such as screening and housing assessments to identify the member's choice of housing setting, coordination for purposes of member transitioning to housing, searching for housing and presenting housing options, or assisting with identification and other legal documents for the member. Tenancy sustaining services, on the other hand, are really those services once we have the member in a housing in a stable housing setting. So those can look like activities such as identifying and intervening for behaviors that may jeopardize housing stability or tenancy, connecting members to community supports for SDOH or our health social determinants of health or health-related social needs, and other mainstream resources, or assisting with preparing for any necessary annual inspections or other housing processes. We're currently proposing kind of a requirement that participating members be engaged in these kinds of wraparound services as a requirement of participation in that 6 months of covered housing described in the previous slide. And that can look different for each member situation, right? Each member is going to need a specifically tailored plan of care depending on their needs. During those 6 months, we're envisioning participating members working towards some kind of permanency goals once the 6 months do expire, once that 6 months expire. Next slide, please. So our H2O proposal also allows us to reimburse for medically necessary home accessibility modifications and remediation services, case management for the target population, as well as outreach and education activities. Of note, the medically necessary home modifications that we are referring to here look similar, but are not identical to those that you might be familiar with us covering for our long-term care population, for those that might be involved in that space. For H2O, these can include activities such as services or environmental accessibility adaptations that are necessary to facilitate a barrier-free member access to their home to increase the likelihood of success and successful community integration. Case management is pretty self-explanatory here, so I won't spend too much time there, but I did want to spend a moment on what outreach and education services might look like under H2O. These are activities beyond the outreach required from our health plans today, and they are provided for purposes of beneficiary engagement in community settings, including linkages to other state and federal benefit programs. This includes efforts to identify, engage, and enroll or re-enroll eligible or potentially eligible members in Medicaid and connect them with covered services. Activities under outreach can include the initial location, identification, and sustained engagement of members on the streets or institutions, really thinking about, building those relationships in the setting that is most comfortable for the member and most familiar to the member, to make some of those bridges to care and providing, basic needs or connection to basic needs, as well as working with providers to update assessments, Z codes, or other documentation related to accessing needs to address, their housing needs for those members that are either homeless or are at risk of homelessness. If we go ahead and move to the next slide. So in thinking about implementing the housing related services, we wanted to spend some time on what eligibility criteria for these services might look like. Our approval allows for us to implement H2O for Medicaid eligible target populations with a documented medical need when the service has been determined medically appropriate. It also allows our special terms and conditions is what we call the document, our approval document. So we also have some special terms and conditions that allows for us to implement H2O on a phased in basis, which is the path we're currently proposing to take. There's a couple benefits to moving forward with a phased in approach and starting small first to make sure that that the program is going to be successful. One of the first benefits is it allows for us to roll out this program in a controlled manner, starting with a smaller target population, which will help to ensure that the system isn't overwhelmed with an untenable increase in requests and referrals beyond what's able to be absorbed. And it'll also allow for us to wrap around, the additional systems and supports that we have available to us to push out, which I'll get into in a moment, for wider scale implementation. So it really allows us to ramp up and ratchet up in a really thoughtful manner. Additionally, it's important to note that we have a maximum amount of funding available for H2O services over the 5-year period. When we open this benefit for a wider for any target population, the benefit becomes an entitlement for that population. And this phased-in approach will allow us to ensure that we don't, expend all of the available funding before the 5-year period ends, and really provide ourselves a nice glide path to permanency and sustaining the program over that 5-year period. Over the next couple slides, I'll go into what that eligibility process might look like, but related to the phased-in approach, did want to note that we're currently considering initiating the program with an initial phase targeted at our seriously mentally ill population. So those individuals who have been designated with a serious mental illness as the initial phase, to start the rollout. So if we go ahead and move to the next slide. What you see on the screen here is language from the approval letter. As the slide indicates, homelessness or risk of homelessness in conjunction with clinical risk criteria are requirements for participation in H2O. These will need to be determined by an assessed need for housing or housing related services. And currently we anticipate the identification of a housing need being reflected via the presence of a housing related Z code in the member's medical record. Additionally, the member needs to have a co-occurring chronic condition, which could include a number of things. We have a sort of a running list of the diagnoses that we are considering, but we're really looking forward to suggestions on how we should sort of categorize that. Additional chronic conditions that we could consider. A couple that we have on our list are things like oncology, cirrhosis, diabetes, hepatitis, TB, even dementia, including Alzheimer's, but really looking for feedback on everything, but on some of the really specific criteria that we're going to be required to articulate to CMS, in order to have an approved spending or implementation plan, excuse me. Again, just want to reiterate, I'll try not to beat a dead horse, I guess, but these are kind of subject to where we land on that phased-in approach. But we really do plan to leverage some combination of chronic conditions and member costs to define the populations that will be rolled out through different phases of our implementation. Next slide, please. So since we're currently moving towards system-wide use of the locus assessment for our managed care providers, the plan for H2O is to leverage some combination of the locus, prepare, and evidence-based screening tools for that assessment of housing need. As part of our approved STCs, CMS has required that we do leverage an evidence-based, that what they call health-related social needs screening tool that have a body of evidence to fall back on. And once a need is identified, the indicator will ultimately need to be reflected in that member's medical record, plan of care, etc. To that point, it's also important to note that a service plan of some kind will be required for participation in H2O as it's currently proposed. This could be a documented housing plan, a behavioral health ISP, a service-centered, person-centered service plan, or other plan of care based on the member's situation and need. Housing need and goal working towards permanency are something that we've been kicking around as something that we're going to like to see on that to ensure for a successful placement after the 6 months is up, or if there isn't the need for the full 6 months, moving into that more permanent situation where the member can sustain their housing on their own without these supports. We also have a lot of latitude in how we design the implementation plan, but it's ultimately that's ultimately where these details will be codified and approved by CMS, is through that implementation plan. So that's really why we're here. These are our proposals. This is as best a place that we could get some of these things before bringing it for feedback. So really looking forward to suggestions in the dialogue. And looking at the time, I'll try to step on it a little bit here. But if we go to the next slide, I'll get now into infrastructure and what that looks like. This is a little bit different from, it's a lot different than the services slides that I just went through. This funding is specifically allocated for, a more specific purpose. So to me, this conversation in the first year might even be more time sensitive as we ramp up for implementation over the next 10 months or so. We really want to know sooner rather than later how these dollars can be best allocated so that we can help you all in the system at large as best we can prepare for implementation. So in thinking about how we're going to implement this program, we felt it was, through our negotiations, it was critical to try and secure funding for some of the infrastructure activities that we anticipate the community needing. Of note, we anticipate that CBOs and other community partners might need some additional resources to become Medicaid billing entities for those that have not been enrolled historically as Medicaid providers. We fully recognize that, Medicaid reimbursement comes with its own level of red tape. So we're very aware of that and want to help where we can. Or for existing providers, we wanted to have some funding to help develop systems or processes that will allow for implementation of these benefits that will be new to them as well. So allowable infrastructure activities can take several different shapes, but they're all described in our special terms and conditions document, which is, again, our agreement with CMS. Really, we're looking at things like the purchase of technology, development of business or operational practices, some limited workforce development activities, and then outreach, education, and stakeholder convening. And I'll dive into what all of those look like here in the next couple of slides. So if we go ahead and move to the next one. Perfect. Awesome. Starting with technology here. So leveraging the statewide closed loop referral system is intended to play sort of a big part in the success of H2O. The closed loop referral system will allow for bidirectional exchange of referral information, as well as assist with the confirmation of H2O eligibility and service attainment. But this is just one example of technology we anticipate that the community might need some support to help implement. Within our H2O approval, we can spend infrastructure dollars on support or seed funding for these kinds of referral systems, for the purchase or training on screening tools, or purchase of data or billing systems, and the like. Additionally, we were able to support the development of business or operational practices that might be needed in order to successfully implement the H2O program. These can take the shape of things like the development of policies, of workflows, or even of things like program evaluation. I'll put a pin in that evaluation word. I have a couple slides on that in a moment, because that will be sort of the last critical piece that I'll touch on. But before I get there, if we go to the next slide, We also have the ability to support limited workforce development activities such as cultural competency training, certifications, and trainings on any new policies or procedures that need to be implemented in order to make, again, this a successful program. Lastly, we have the ability to leverage some of the infrastructure dollars to help train the community and or recruit new partners through stakeholder engagement and community education. So again, just for context, we have right around $13 million a year to help with these infrastructure plans, but we know that it's a big system. There's going to be a lot of strains on those dollars. So we are really looking forward to hearing, in addition to, the program as a whole, conceptually how recommendations on how to implement what'll work well, what won't work well. We're really looking forward to hearing, what the bottlenecks are that exist currently on these kinds of activities and where we can allocate these dollars most appropriately and most effectively as well. All righty. I'll get into evaluation at a high level and then turn it back over to Marcus. So I'll go through these really quickly. Won't go through all of the content on this slide for the sake of time, but suffice to say, all of these activities that we're discussing have to be evaluated. That is one of the requirements of an 1115 waiver. It's written into federal regulation, is that these waivers must be evaluated by an independent third party. It's technically a demonstration as it's written under Medicaid law. So over the next 5 years, we'll need to prove the effectiveness of H2O in order to justify renewing the proposal in 2027 or renewing it, taking a new shape. But that evaluation component is key. So we'll be working with you all and the community at large when setting up our evaluation design plan, but would really love to hear any feedback on, if you have any at the moment, on data or data sources that we should be considering as we move into our initial design plan to start to think about how we can measure effectiveness. What does that look like? And what data sources can we leverage to show that effectiveness? If you move to the last slide, here's some examples of those data sources that we're currently considering and that we know exist. I won't spend too much time here, but welcome your feedback on what we might be missing or what we might have erroneously included on this list. Before I hand things back to Marcus and the Vitalist team, I just wanted to leave everyone with the reminder that, the majority, again, of what I discussed is malleable and is proposed program structure at this point. We do have a lot of leeway in how we craft our implementation plan. So we're really thrilled to be here, really excited to get your feedback on all the things that will work, the things that will not work, and maybe more importantly, the things that we haven't even considered yet. I think that, we know what we know, but we work in a Medicaid program. We live and breathe it every day. So I'm sure there are things that we haven't thought of, and really looking forward to hearing what those might be. Thank you so much. I think that ends it for me. Marcus, I'll turn it back to you. Hopefully I didn't go too far over, but let me know if there were any questions. I definitely have not been looking at the chat.
No, that was actually right on time, Alex. Thank you so much. I'm going to kick things over actually to our day's facilitator, Emma Fryer, to facilitate the rest of the day.
Thanks, Marcus. And thanks, Alex, for your presentation. We can spend about 5 minutes now if anyone has any questions about what Alex just shared with us for the Access team. Before we get into the group discussions and the breakout rooms, are there any questions to just clarify the information we've just received? And you can raise your hand if you want to jump in, or feel free to put questions in the chat as well. And then Alex, if you want to you can stop screen sharing anytime you're ready. Also, just a friendly request, now that we're moving into more of the discussion part of the day, if you're able to turn your video on, please do so. It just, makes it easier to chat with people, and it's a good way to get more interaction and feedback if we can see each other's faces. Thank you. All right, So I just saw Vicki Phillips raised.
Hi, everyone. Thank you. First of all, I just want to comment on the fact that I was glad and very happy to see that enhanced shelters were part of the discussion and part of the inclusion in this. I think that's fantastic. Just a couple of questions with regard to that, maybe a further clarification. Funding, can you clarify again what funding can be applied to? Is operational expenses part of that for enhanced shelters?
I'll take a stab at that, and Liz, you're definitely the expert on this more so than I am. That's something, operational costs are something that we're currently considering. I think it's important to note, though, as all of this is very much still subject to CMS approval of our implementation plan. So as we're currently envisioning the program, those would be costs sort of built into how we're envisioning reimbursement for a portion, right? A part of that 6 months of short-term housing, that transitional housing. But Liz, don't know if you have any additional detail you'd like to provide there, but the short answer is currently it's on our list.
Yeah, absolutely. It's on our list. And then also if you have any additional thoughts as a community for what else we should try to consider to cover in enhanced shelters, and please bring it forward today. We do have to ensure that we have a maintenance of effort plan too. So we'll be asking a lot of questions around what fund sources are currently going into enhanced shelters and how do we make sure that we're still incorporating that into our community design once this is rolled out.
Can I just add on to that further, and then I'll be quiet. With regard to the enhanced shelter discussion, are we looking at identifying or opening up a specific provider type in order to be able to move forward on that?
Yeah, that is definitely something that we're considering. And I just want to take a little something that Liz said and expand upon it a little bit. And it's in one of Alex's slides and a little footnote that you guys can reference later, but also part of the requirements from CMS that's called a maintenance of effort is that we can't supplant any existing funding that exists today, right? And so everything, city, local, county, state funding that we have today, we can't just replace it with this. This is to be additional and to add capacity. And so you're absolutely right on as far as thinking about how we would reimburse for it. Would it be a new provider type? Those are all things to work through, and we would love the feedback on them too, as to what you all are thinking.
Great, thanks. Michael.
Thank you. I'm just trying to get a sense of the scale. I know, I think early in the slide, there was something about, and I think this is the 1115 waiver, that it's budget neutral. So, but are there new resources in like 5 years, I heard, is the funding. And so, I mean, what's the thinking in terms of annual budget, for example?
So, well, I'll try not to get into the weeds of Medicaid finance, I guess, and budget neutrality modeling. We got what was called the hypothetical budget neutrality model for the H2O program in particular. So it's, for intents and purposes, based on a year-over-year budget. So we have about 90-ish million for program under H2O per year. And we have about, again, 13 million or so in addition to that we can use for those infrastructure types of costs. We know, again, that the first year is going to be mostly implementation. We can roll some of that funding over from one year to another. So we do have a little bit of play as it relates to, you know, what the top end budget is year over year. But that's just to give you a ballpark. That's about what we're looking at.
And then just to add to that, when we're talking about budget neutrality, even when we're supplying someone with housing or some of these supports, we're also ideally hoping for an offset of some other costs as well. And so that's what we work through. And the whole waiver itself, housing is one piece of it, is subject to budget neutrality, right? So we're trying to do proactive services, meet people at the least restrictive level of care if possible, all of those different things. And so a lot of this should see an offset on other programming and costs that we see today, such as inpatient stays, ED utilization, all of that stuff.
Thank you.
Thank you. Thanks for your question, Michael. We've got two more. TJ, you were up next.
Hi, everybody. Yeah, thanks so much for the presentation. I'm with Maricopa County, and I know I can't speak for all funders here, but I talked to Vitalist about this, and I think there is appetite and interest from funders in our community to really collaborate with you, especially understanding that this can't be replace other funding, but in some instances we kind of wanted to maybe, or like if we can leverage our ability to, hey, if you can fund this, can we shift our funding elsewhere to really make the dollars go as far as possible? And so I'm really interested and hope that our community of funders and yourselves can have kind of like ongoing working sessions related to that aspect of it, so that we can really partner together in, again, making those funds go as far as possible. So I don't know if it's a question more as just like a comment, and if you have any thoughts on that, like if that's able to be done, that would be awesome.
Absolutely. Yeah, this is the first of many, I think, working sessions with, organizations such as yourselves and other community partners that we're going to need to bring in. I think that was one of the first things that came to our mind when we got 6 months was, okay, what happens after 6 months? How do we ensure that that successful collaboration with other entities to make sure that there's that long-term placement at the end of the road? We actually have a special term and condition in our waiver that well, I don't want to say it requires us because that makes it sound like we wouldn't have done it anyways, but we are required to show our work on how we're collaborating with other partners. So that's very much something that we have on the top of our list to draw out, what those collaborations look like, how we're going to be connecting participating members to other available resources and the like. So definitely something we're looking forward to doing, and conversations we're looking forward to having. I had one more thing, but it's slipping my mind now. Oh, maintenance of effort, I think, is mostly related to the funding, right? And I think that logically it makes sense that if you can do this with this funding now, if we can set up a structure that can help expand capacity on the back end and maybe make for more of those successful placements on the back end, that seems like a perfect world and a pie in the sky to me. So I'm glad that we're already thinking about that now, and that there's alignment on the front end. So yeah, really, really exciting times.
Thanks, Alex. Thanks, TJ. Anthony.
Good afternoon, everyone. I'm here at the Human Service Campus. So, quick question. So, with the 30 days, I want to kind of squeeze into the conversation neutrality and understanding we're not replacing one for another, but are they interacting with one another? So, information like we have individuals who are older individuals who are experiencing homelessness for the first time, and they're not actually fit for shelter because they either can't take care of themselves or they're needing a higher level of service, but they do have their own somewhat funds like disability, or they have access to some type. Is there a conversation that program fits into? For those dollars to work with that, like that 6 months transitional or that 6 months temporary, because what we're looking at is what happens to the individual that we can't place in regular housing, but we're still trying to move them into a safer way of life other than just being in a shelter all the time.
So are you asking, like, can a member potentially have, be within their 6 months of temporary housing and have other wraparound supports brought in at the same time, and also be able to still participate in their other benefit programs that they're participating in at the same time?
Yes.
Yeah. So yes, for sure. That's our intention. We know that some of these services that we're talking about, things like the pre-tenancy and tenancy sustaining services, are available for some populations today, right? So we would obviously want that to continue, and then for the new services like the transitional housing to be sort of in addition to those services. In addition to that, we want to keep top of mind that transition to a successful placement, right? So one of the things, and Liz, if you want to add more to this, feel free, but that we've been kicking around is collaboration with the Access Housing Program, other federal housing programs as well, to make sure that, this can serve as a bridge to that permanent housing, right? Even if it's not a transition in place kind of setting, it's a placement where there can be some stability, an ability to get back on feet, and engage in services, and then, transition to, a different stream of funding, right? A different resource that you can participate in, parallel. So I don't know, hopefully I hit on everything there that you were asking, but Liz, I don't know if you have anything to add either.
Yeah, the only thing I would add is I think, Anthony, that conversation really lends more towards the priority population in which we are going to target as a community. So something for you to kind of present during these stakeholder meetings. It sounds like you're referring to aging adults who maybe have chronic conditions, who are living in congregate settings. So just a recommendation for you to continue to bring that up as potentially a priority population. And then important for us to note that we do need to hone in on a specific population to make sure that we're really able to demonstrate effectiveness in the waiver. So it may come in as a phased approach as well.
Thank you very much.
Yeah,
Thanks, everyone.
I think just one other way I would look at this too, obviously all of these services, minus just the outreach, are for people that are on Medicaid. And so this is just yet another tool in the toolbox, another service added, and should not hinder anyone from participating in the remaining services that people are eligible for. So just another add.
Thanks. All right, we're a little bit over, but Katie, I want to hear from you if we can do your question a little quickly here, and then we'll move on to the next one. Thank you.
Thanks so much. I guess more of a broad question, but is there ability to kind of like maneuver in years 3, 4 and add different services, or is it kind of during our implementation phase, this is the implementation for the 5 years? What is like our ability to pivot or add services, or say these aren't working and we need to change what we're doing?
Can you give maybe like an example of a service that you're kind of thinking of?
I guess less so. This kind of went to TJ's like supplanting conversation, but with a lot of things kind of closing in 2024 or 2026, kind of as American Rescue Plan phase is shutting down and we still have this funding available, just trying to think through like how much ahead of the game do we need to be thinking versus come that funding ending, we may be thinking about something else that needs to get added that would be eligible under this pot of funding.
Yeah, I think it's a really good question and kind of goes back to that evaluation component, right? We're trying to, in parallel to building the program, we're trying to think about like, how do we build it to be successful, but also how do we monitor longitudinally a member's journey through care? And if those settings happen to change because certain resources go away, or the prioritization of this funding gets shifted from one thing to another because of some of those resource needs in the community, that might be a conversation worth having, but we'd have to be thoughtful about, okay, well, how do we evaluate the effectiveness over the 5 years if we were paying for, these 4 things the first 2 years, and then, a totally separate set of 4 things, or 2 of the same and 2 different ones the next year, right? So I guess the answer is kind of a non-answer in that I think there's ability to do that, right? Like we have some flexibility to be nimble with some of these funds. The services are approved as they're approved. Those are pretty set in stone as far as our STCs go. But how we prioritize those populations, I think, is really going to be our number one lever that we can pull to allocate resources appropriately across the system as the needs are presenting. And I think that's really where we can be most nimble and pull different levers.
All right. Thank you. Thank you for your questions, everyone. And thanks again to Alex and the rest of the team at Access for your presentation and for these great questions and answers. We're definitely not going to have any shortage of information to discuss in the breakout sessions, so that's exciting. Before we do that, let's just take a quick temperature check and answer a few poll style questions as a group. So Jill is going to drop a link in the chat to Mentimeter. Mentimeter will allow you to kind of answer like a survey or poll style question right from your phone or your computer. So she just put it there now. Also, I wanted to let you know that if you need help from Jill with tech support today, you can actually chat to her as tech support. You'll see her name that in the chat where she just shared the link to Mentimeter. So if you click on that link, it'll open a new web page for you where you'll be able to see the first question. So let's take about 30 seconds here for everyone to open that up and answer the first question. So this is asking big picture, how are you feeling right now about the H2O program? So we've got a scale from I'm totally uninterested to this is the best thing ever. So if everybody can just take a few seconds and let us know how you're feeling, that would be great. And as Anthony did, which I love, if you also want to just add anything in the chat, feel free to do that too. We'll be moving on to the next question pretty quickly here, but so far it sounds pretty good. The suspense is killing me. .1, that's pretty good. So it looks like the initial reaction is really positive. I'm happy to hear that. And I think this, yeah, this makes me very excited too about the rest of the day. Okay, so the next question, if resources were not the issue, which of the allowable services would you be most excited about your organization providing? So you can see here on the screen, it looks like overwhelming, off the charts excited about being able to provide that rent or temporary housing. The navigation support and transition is also ranking pretty high. So that looks really good as well. We'll also, I can't remember if I mentioned this at the beginning, but I'll remind you a few times throughout the day that you'll be getting a survey at the end of the event today too, so that you can provide feedback on the day, but also have an opportunity to share any other feedback that you have for the H2O team. All right. Well, thank you for participating in these polls. This will be really useful to the team. You can leave your Mentimeter voting window open as we'll return there later. But for now, we're going to split up into breakout groups. So the next half an hour will be divided into 6 different groups. Each group will have a facilitator from the Vitalist team or the Fryer and Associates team. And they'll help guide the discussion and answer any questions for you about how it's going to work. But there are going to be 2 questions to answer as a group. So the first half, about 15 minutes, we'll spend answering the first question, and then everyone will get a notification to move on to the second question. And we're using a tool called Idea Flip. And so I'll just do a really quick demo now, and unless Jill is able to screen share quickly. All right, I'm going to do it here. So you should be able to see there are 6 small boards on here. What you'll want to do right away is as soon as you get assigned a breakout group, it'll be named with a number. So number 1 through 6, you'll know what your number is. So use this Zoom tool on the left-hand side, the lower left-hand corner of the screen, to zoom in and look for your room. And you can click and move the screen around. You might be able to use, if you have a trackpad on your computer, to find your number that matches up with the breakout room that you're in. You'll see that each room has a little pile of sticky notes right next to it. So you can just navigate to this screen and make it large enough to see. And then as you're answering the questions, you can just grab sticky notes from the left or the right hand side, and you can just type your input here. And so that's how that works. Your facilitator will go over it with you again once you get in your group. It might take a minute or two for your facilitator to arrive. So once you get the link and you get your breakout group number, just go find your board and hang out there for your facilitator to arrive. We'll do a really quick round of introductions and then get into the questions.
Hey, Ms. Emma, the link is in the chat. If everybody wants to access their idea flip, I'll go ahead and open the rooms.
Great. Thank you. See everybody in a half hour. Welcome back, everyone. Give everybody a minute or two to get back. All right. I think everybody's here. Just a reminder, if you're able to turn your cameras on, that's great. It's nice to see everybody's faces. All right, everyone's back. So I hope that you enjoyed your breakout discussions. Thank you for taking the time to share your feedback and to have conversation. I know just from the group that I was in, I was really impressed by the ideas and the insights, and I think it's going to be incredibly valuable. And I look forward to hearing from the rest of this larger group. So now that we're back, we're going to move into some discussion questions with this whole group. As we did earlier, feel free again to either put your answers or in the chat or raise your hand if you want to share and speak. Just a reminder to try to keep your spoken comments under a minute, just so that everyone who wants to speak today has an opportunity. Reminder that this won't be the last conversation that we all get to have. So we'll spend about 8 or 10 minutes each on 2 different questions next. And I'll put this one in the chat too. So first, what is the one barrier or challenge that you would really prioritize to have Access remember as they're developing their implementation plan? So if you had to pick one, what's the one you really want them to remember? What do you want to emphasize? Flexibility from Norm. Nice. Collaboration from Katie. There isn't enough housing already. Consistency through the 3 AHCC RBHAs. Jessica says needing help and tech assistance with billing, all admin pieces. Also seems very challenging that we'd be billing each health plan separately, not Access directly. supporting the smaller nonprofits who have boots on the ground. Easy access. Maintaining service quality and fidelity. Housing Continuum is a side-by-side development to this program. So post 6-month support is not a cliff. Begin evaluation early, begin data quality assessments early. Managing the administrative requirements associated with billing Medicaid. I think if there's one of the words I'm seeing the most is administration, that's for sure.
That's why I said easy access.
Mm-hmm. Be a nice campaign for access, easy access. More clarity on the definition of temporary housing. Is this temporary assistance for either permanent or temporary housing and or support for transitional housing programs? That came up in ours as well. Does maybe someone from the Access team want to quickly address that, just to add some clarity here?
Yes, I can take a crack at that and turn it over to the rest of my team. But yeah, I think really at its core, we're talking about 6 months of temporary, a stable temporary placement, right? I think there can be an option if the stars align and if the setting complex, whatever it is, allows for it to transition in place. But I think really we're what we have the authority to do is provide that temporary placement that's meant to serve as a bridge, either from institutional discharge, homelessness or risk of homelessness, or transition out of the foster care system, provide that 6 months of stability to work towards that more permanent placement. And I think that 6 month time frame, I think it can take a lot of shapes, right? That could look like rent, right? That could look like the enhanced shelter. It could look like something that we haven't even really considered. So I think those are the kinds of ideas and that's the kind of feedback that we're looking for. We can't promise anything, right? But we can at least evaluate it to see if it'll work as far as what our approval is and if it will overlap cleanly and all the rest. So I think the short answer is it can look like a lot of different things, but the intent remains the same, that we're really wanting to provide that bridge towards long-term stability with continued wraparound supports, right? The wraparound supports will need to be in place before, during, and after that transition, and at different intervals and at different program intensity for every member, right? So that's a really critical part of ensuring that success. But I'll stop and see if anybody else on the team has anything to add.
Alex, I think you did a wonderful job. I put the technical language in the chat so that people could refer back to it, and it's in the slides too. But keep in mind, we're kind of peeling an onion here. They gave us this parameter, then we need to make it more specific, then we need to get their approval and make it even more specific. And so we really look to you all to think, within those parameters, what do you think is the most important? What do you think is going to be the most effective here in Arizona? What do you think is going to lend to the best transitions to some sort of permanency of something, right? And so whether that's a transition to maybe something else, or a housing voucher, or maybe a lot of people do have somewhere to return, maybe after they have a lot of support. And so just different things and ways of thinking of people's recovery. And I think that goes right along with client-centric focus in your decision-making.
Thanks, Dana. All right, we're going to move on to the next question. We're going to spend about a minute on this one. And so what I'd like to do here is to have everybody drop the answer in the chat to this one. So thinking of all of the resources that you've just talked about in your breakout groups, what's the one that would be the most helpful in overcoming a key challenge? So think about kind of what your most important, that number one resource would be, and let's drop that in the chat.
This may sound offensive, but please don't take it that way.
Yeah, these are great. Thanks, everyone. Okay. All right, so we're going to go back to Mentimeter. So if you still have that browser open, hop back over there. And the question here is really around, what if we succeed? What does success look like? So if all of these challenges were overcome, what would it mean for your organization and the people that you serve? So let's spend a couple minutes here thinking about that and what success means for the people you serve, and go ahead and enter that in. And if you close your window, the link to Mentimeter is back in the chat box. These are amazing. End of homelessness as we currently know it. Oh. Better health outcomes, safety, support, and stability in a transitional setting. Y'all are gonna make me cry. This is really amazing. All right. If you still are thinking in this space, feel free to keep typing. But as we prepare to wrap up today, I just wanted to share a few kind of highlights or themes that we're seeing, and then a reminder about the next steps. And then I know Access Vitalist and the Arizona Housing Coalition is going to send us off. But one thing that's really coming up for me, that I was seeing in our larger conversation and really in the breakout room and then now, is that there are a lot of challenges. There are more solutions and ideas. What I'm seeing come from this group is incredible. And I think the ideas that are here, the depth of knowledge that is here, makes me feel from a from an outside facilitator standpoint, but as somebody who's been I think really immersed in this for a while, these opportunities are immense. And I think that the thinking within this group is really important, and I think will be incredibly useful to Access. And so I'm really excited about the potential for this program based on just what I've heard in the last hour and 55 minutes. A few of the themes that are popping up too. One is collaboration, and I think that kind of supports what I've just shared around that first observation. And so I think whether it's small and large nonprofits working together, whether it's different types of organizations coming together, whether it's leveraging relationships with direct service orgs and hospitals to, help support outreach and intake. And, I think the pieces around collaboration are essential. Outreach and education and admin and technical assistance seem to be pretty big barriers, but again, there is a huge amount of ideas here in this space that I think could really help inform the way that those are approached. And then, the continuation, what happens after 6 months, is another really big point that I think needs to be addressed and is being addressed, but that's one that just continues to pop, and I think is going to be really important in these next steps. So I just want to thank everyone. I want to thank the, our facilitators today and the folks at Access and Vitalist and the Housing Coalition and all of you who have been on this call and who've participated and dedicated this time and resource, to help be part of this event today. So thank you, thank you, thank you. And I'll turn it back over to you, Marcus, to close us out.
Great. Thanks, Emma. And thanks again to everybody for participating. I know that this is a big chunk out of your day, and approaching the holiday or being in the middle of the holiday season, it's near impossible to get so many people scheduled. So we really do value your participation and the community's insights in this session. Just as a note for following up, we are going to compile all of these great ideas. We will be sharing them with the entire audience along with Access. Like Emma said, this is not the end all be all when it comes to community input for this particular opportunity. There's going to be a follow-up survey and evaluation that we send out to everybody that will also provide additional opportunities for gaining your insights and gleaning your input on the H2O program. So be on the lookout for that. I know it's yet another thing to do, but we would really appreciate any feedback that you're able to offer that we can share with Access as they move forward in their implementation plan. Before closing, I want to kick it over to any of the team members at Access. Are there any pieces that you want to reiterate to the audience or note before we close out the day? So Dana, I'll start with you.
Sure. Thanks so much. I just want to express my extreme gratitude to all of you. I know all of our time is very precious and we're very, very busy people, but the fact that you dedicated such time today to this incredible opportunity for Arizona and gave us amazing insights. I think this is just the beginning of our journey, but I really do want to thank you for all of your insight, experience, and thoughts today.
All right, gang. With that, we will adjourn. If we don't see you before the holidays and the Christmas season and New Year's, a happy holidays to you and your family and your colleagues and your close friends. And we will see you all in the near future or perhaps in 2023. Take care, everyone.
Thank you.
Thanks.
Did you want to stop recording, Emma?